Good afternoon, Ms. Lacoto. I'm
Hello.
Catherine McHale. I am a nurse practitioner student who goes to Thomas Jefferson University in Philadelphia,
Okay.
and I'm here at this practice this semester for my comprehensive assessment course. We're practicing some of our assessment skills as well as our health history taking.
Okay.
So we're just going to start out by finding out why you're here, and then since you're a new patient with us, we'll go into your health history.
Okay.
Okay. Do you prefer to be called Ms. Lacoto or Lauren?
Lauren's fine.
Okay, I'll go ahead and call you that from now on then. So Lauren, what brings you in today?
I have a little bit of a dry cough, pretty consistent cough, raspy voice.
Oh, really?
Yeah.
When did that start for you?
Probably over the weekend or like Saturday.
Saturday, so
Yeah.
today's Wednesday. It's been going on about 4 days bothering you
Yeah.
then. Okay. And the location, really, is it kind of in your throat or anything in your mouth bothering you, your neck?
Or so just for
The throat. Okay. And can you describe your cough to me?
Just dry and
So not really much drainage coming
no,
out with it.
no.
Okay, good. Do you have any other symptoms along with it? Fevers?
No.
Okay, what about nasal discharge?
Yeah, I've been noticing that too.
Okay. What color is the discharge?
A little yellowish.
Yellowish.
Yeah.
Okay. And does anything seem to make the cough better?
Not that I've noticed, no.
No. Anything aggravate it, make it worse?
No.
No. When you cough, do you feel like the pain sort of radiates out of your neck into your back, or no? Okay, that's good. And any time of day that it seems to get worse, when you're sleeping at night?
No, not really. I haven't really noticed that, no.
Okay, good. And the severity of the cough, 10 being the worst cough imaginable that kind of keeps you up all night and really hurts a lot, and 0 being it really doesn't bother you at all. Where would you rate your cough?
Say about a 4.
A 4, so somewhere in the middle there.
Yeah.
Okay. And now I'm just going to ask you some general questions about your health, and kind of just, you can tell me yes or no whether that really bothers you or it doesn't. Okay. Have you had any weight changes recently?
No.
No. Any generalized fatigue?
No.
No. Okay, good. And any problems with your eyesight? I know you wear glasses. Do you wear corrective lenses as well?
Yes.
Okay. Any vision changes you've noticed?
No vision changes, just, I have chronic conjunctivitis, so
Okay.
that's why I'm not wearing my contacts right now. It's been kind of acting up recently.
Okay. Is it, do you seek doctors?
Yeah,
Okay.
I've been seeing
An optometrist.
Yeah.
Okay. Alrighty. And any hearing changes that you've noticed?
Just more so, like when there's background noise, I notice that it's a little bit more difficult for me to hear someone else talking to me.
Do you notice that's a change in your hearing from where it was before?
Probably, over the past year or two that I've noticed a little bit of a difference in that, but, not majorly, but...
Noticeable.
Yeah.
Okay,
Yeah.
well, that's certainly something we can look into and test your hearing when we do your physical exam. Take a look at that. Okay. In your neck, have you noticed any swollen lymph nodes at all?
No.
Any tenderness with swallowing?
No.
No. Okay, good. Do you do self-breast exams on yourself?
Yes.
Have you noticed any dimpling?
No.
Okay. What about lumps in your breast at all?
No.
No, that's good. Respiratory-wise, I know you're having some problems right now with your cold. Any shortness of breath on when you don't have your cold?
No.
No. Any trouble laying flat at night?
Mm.
Okay, good. Heart-wise, any heart troubles that you've noticed?
No.
Ever have any chest pain?
Mm-mm.
Mm-mm. Feeling of your heart racing?
No.
Okay, good. How's the bowels working for you?
I've noticed, I can be constipated at times,
Okay.
and then I'll be fine, and then, yeah.
Does it, do you ever have to take anything for the constipation?
Sometimes I'll take some stool softeners, yeah.
Okay, if it
Yeah.
starts to be a
If
couple
it's-
days
yeah.
or something.
Yep.
Okay. What about vascular-wise? Do you ever notice any coolness in your extremities?
I've been diagnosed with, a mild form of Raynaud's.
Okay.
Yeah.
And that happens with weather changes, or?
Yeah, I guess so, yeah.
Okay. What about pain in your legs when you're exercising?
No.
No. Okay, good. Any problem going to the bathroom at all?
No.
No. Okay, good. And then, are you having any sexual dysfunction or difficulties you'd like to speak to me about today?
No.
No. Any problems with those joints?
No.
Creakiness or trouble moving them? Okay. And any feelings of low mood lately that kind of got you down? No. Feelings of anxiety?
No.
Weighing on you? Okay. Any dizziness that you've noticed?
No.
Headaches?
Sometimes I can get headaches. I know some when I'm stressed. I get them in the back of my head.
Okay. Do you take any medications for those when you get them?
Just ibuprofen.
Ibuprofen. Okay, and it seems to work out for you?
Yes.
Okay, good, good. Any vertigo or balance issues?
No.
No. Any unusual bruising that you've noticed?
No.
No, that's good. And any intolerance to heat?
No.
Intolerance to cold?
No.
Dry, flaky skin?
No.
No. Okay, good. Any new rashes that you've noticed on your body at all?
No.
No bumps or anything? Okay, good. So now I'm just going to ask you about your medical history and some things that you may have been diagnosed with before coming to see us at our practice. Anything that you've ever been told. I know you said the Raynaud's and the chronic conjunctivitis. Anything else?
I've had some acid reflux.
Okay.
Yeah, I've been diagnosed with that.
For a couple years now?
Yeah.
Okay.
Yes.
Anything else?
That's about it.
Okay. Any type of psych history like depression or anxiety?
No.
No? And specifically any type of women's health or OBGYN history?
No.
Okay. Now surgery-wise, have you had any surgeries before?
I have had a meniscal tear or repair. And then I also had a benign tumor removed on the back of my leg when I was younger. And I also had a mole removed from the white of my eye, my right eye.
Do you know the years when you had those surgeries?
The eye surgery probably was in 98. The tumor was 92. And my knee was probably like 2002.
Okay. Any immunizations or vaccines that you have not gotten?
No, I'm all up to date on this.
Up to date, okay. Have you traveled outside the United States or even within the United States within the last couple months?
No.
No. Are you on any medications currently?
Yes, birth control, Gildes. I'm also taking just Zaditor eye drops for my conjunctivitis right now, and Prevacid and Adderall.
Okay. Do you know the dosage on the Prevacid?
I do not know that.
That's okay. You can go ahead and call your pharmacist about that. Do you take it once a day?
Yes.
Okay. The Adderall, do you take that for ADD?
Yes.
Okay. You take that in the morning?
Yes.
And do you know the dosage on that?
20 milligrams.
20 milligrams. The eye drops, are you using them once a day, twice a day?
Twice a day.
Twice a day. And then the birth control you take once a day?
Yes.
In the evening?
Yes.
Pretty good about taking that?
Mm-hmm.
Okay. Any other medications that you're taking? What about herbal supplements?
No.
Vitamins?
No.
Or over-the-counter meds that you take frequently?
No.
No? Okay. Have you ever been diagnosed with any allergies?
Yes, to pollen and animals, cats and dogs specifically.
Cats, dogs, pollen.
Mm-hmm.
And what about any medications that you've been allergic to in the past?
No.
Any type of foods?
No.
No. Okay. And I know you said that you're on 4 medications. Do you have an insurance prescription plan that covers that?
Yes.
Okay, good.
Yeah.
Helps you out with the cost
Mm-hmm.
of those. So now I'm going to ask you a couple questions about your family history.
Okay.
I'm just going to ask you some probing questions, and you can tell me if any of your first-degree relatives had any of those disorders.
Okay.
Any type of cancers?
My grandma had lung cancer.
Okay. Any breast, ovarian, colorectal, prostate cancers?
No.
Okay. Thyroid disorders?
No.
Okay. Genetic disorders that would be inherited, like sickle cell disease, cystic fibrosis?
No.
What about stroke?
No.
No. Diabetes?
No.
High blood pressure?
My mother has it.
Mom. Okay. High cholesterol?
My father.
Father. What about heart attack, heart disease?
My grandfather had a heart attack.
Grandfather. Okay. Alrighty. And do you see a doctor on a regular basis?
Yes.
Yeah. What about a dentist?
Yes.
Okay. And so now I'm going to go into sort of a social history for you, and some of the topics might be a little bit more close to home or sensitive questions. So if you have any questions about why I'm asking them, you can go ahead and let me know.
Okay.
And if there's anything you're uncomfortable with answering, you can let me know that as well.
Okay.
Okay? How would you rate your general health? Would you say you're generally in good health, or kind of fair, poor health?
Good.
Good health. Okay. Do you what do you think about your diet? Pretty good.
I have my good and bad days. but generally good, yes.
Okay, well, I think that's fair. Everyone has their good and bad days. How about an exercise regime? Do you exercise quite a bit?
Yes,
Yeah.
I run and lift weights at the gym.
Okay, well, I'm glad to hear that. And who do you live with at home?
My parents.
Your parents? Do you live here in the Baltimore area?
No, back in Lancaster.
Back in Lancaster area. Okay. Do you have any children?
No.
No. And would you say your parents are a pretty good support system for you?
Yes.
Yeah. You have anyone else that you would say you can rely on for support?
My sister and brother-in-law and friends.
Okay. And I know you said you like to hike and weightlift and run. Is there any other interests that kind of like or hobbies that you have?
Probably just going to the beach.
I think we all like that.
Yes, yeah. Reading, that's about it.
Yeah. Okay. Well, I like to read and go to the beach too, so we have that in common. So some questions that we ask everybody. How many alcoholic beverages do you consume a week?
Probably on average like 2.
2. Is that wine, beer?
Wine and beer, yeah. Mixture.
Liquor?
Yeah.
Okay. Do you use any illegal drugs like heroin, cocaine, methamphetamines? No. Have you ever used any prescription drugs which you weren't prescribed? No. Okay. Do you smoke cigarettes?
No.
Smoke marijuana?
No.
No. Okay. And what do you do for a living, Lauren?
I am a student. I just graduated, going as a physical therapist assistant.
Well, congratulations.
Thank you.
Do you take a board exam for that as well?
Yes, in July.
Oh, coming up then. You've been studying for that.
Yes.
Yeah. Alrighty. So I'm sure that's kind of a stressor weighing down on you, but do you feel like there's any other stressors that you have right now?
Just between that and getting a job.
Mm-hmm.
Yeah.
Understandable.
Yeah.
When stressors come up in your life, do you feel like you're able to cope with them pretty well?
Yeah. Yes.
Okay. Do you have any religious or spiritual beliefs that you'd like me to document for you?
I'm Catholic.
Catholic. Okay. And do you feel like there's anything in your medical history you'd like to talk about today that we haven't covered?
No, I think we covered everything. Yeah.
Okay. So I'm going to step out and share this information with your nurse practitioner that's going to see you for a physical exam, and I'll be back in with her. And it was a pleasure meeting you today.
Nice meeting you.
All right. We'll see you shortly.
Okay.